Hi everyone, my name's Ali and I am the current Dental Society President here at Barts in London. Tonight I'm here talking to Shivam Divani. Shivam is one of our recent Barts in London dental graduates and I'm really excited that he's come back to see us today to talk about a very exciting oral health project that he's been working on for the past few years. Shivam, thanks for coming in to speak to us today. It's been great to see you.
First of all, thanks for having me, Ali. I really
Cheers.
appreciate that. And I've loved what you've done with DentSoc, and I can see you really moved it into another phase. So, well done.
Thank you, I really appreciate that and I'm looking forward to speaking to you about everything today.
Let's get this started.
Let's do it. So Shivam, for those who may not be familiar with you or who may be students now and after you graduated, could you please introduce yourself?
Sure. So I graduated in 2016, and then I went on to do my foundation training in a fantastic place in London.
Nice.
I got on really well with my trainer, and he was really good. He's quite enthusiastic about teaching. And now I'm working as an associate.
So Shivam, you're here today to talk to us about your oral health project. It's called My Dental Care.
Yeah.
What inspired you to do this?
The idea came to mind when I was at my nephew's first birthday.
Mm-hmm.
His parents came to me and had quite a lot of dental questions.
Mm-hmm.
And I was surprised that no one's had a chance to speak to him about it, or there was no point of contact for dental education out there. So I knew there was a gap in the market, essentially.
Yeah.
And then being a dental student, we used to give out loads of advice, but we never had any leaflets to give to our patients.
Mm.
And rightly so, people won't remember all the stuff that you tell them in one visit.
Yeah.
Even after several visits.
Yeah.
So I want to create something that a user can take home with them. Yeah.
Mm-hmm.
And at least they have somewhere to refer to.
So why did you go for an app?
So when I was thinking about the issue of there wasn't ever a point of contact for my nephew or his first-time parents, I was thinking, how can I improve oral health education and promote it, and what's the most effective way?
Mm-hmm.
And then I thought, well, okay, I think with everyone having smartphones nowadays, it would be useful to have an app.
Mm-hmm.
We can always update it. It's paperless, so it can save money in that run, and the users can always have it in their phones, whereas leaflets can get lost.
Yeah.
And that was why I landed. I think the best way to sort of spread the word or create something and make it effective and efficient would be an app.
Yeah.
And I got in contact with an app developing company called DigiWrite.
DigiWrite, okay.
Yeah. Who found out about the idea and loved it and actually made it into reality because they sponsored it and created the project.
That's brilliant. That's what you need.
And they were unbelievably supportive. They thought it would really help. I think someone on their team actually works for the NHS. So they thought, look, we're just going to help this no matter what.
Yeah.
And they've been brilliant. So once I had that in play, then I started going through the content.
Mm-hmm.
And that's the story for another day, because it took so long writing that.
I can imagine.
And you get a little paranoid because you know that, look, your friends, your colleagues, maybe patients, patients are going to see this.
Yeah.
So every sentence you write, you think, oh, maybe I should write this way, maybe I should go this way and stuff. So before I even showed it another colleague, that was probably the 20th draft.
So now that you've told us about the app, could you show me how it works? Could you show us how it works?
Of course. Let me bring it out. Okay. So the user will just go to their iPhone or App Store and type in My Dental Care.
Mm-hmm.
Yeah. They'll download it and they'll see a home screen. Okay. With 6 key sections.
Mm-hmm.
Okay. And then it covers 4 main topics, which is about tooth decay, gum disease, tooth wear, and children's teeth.
Okay.
And the overview is oral hygiene. Yeah. So if the user clicks on oral hygiene, they'll get questions such as how to use a manual toothbrush, or how to use an electric toothbrush, or what do they expect before a user starts using interdental brushes or flossing.
Mm-hmm.
Yeah. It's got pictures, so it goes over each key stage. But the other thing is, it's got separate headings.
Okay. Yeah, it's very thorough. It covers everything, but in a nice, simple fashion, right?
Well, that's the hope, anyways.
Yeah.
Who knows?
Yeah.
We'll find out after the next couple of months.
Uh-huh. I've got to be honest. I mean, I know it's intended for patients, but I'm still only a third-year dental student, and I'm gonna be using this for my own revision, for my own sake, and also to be more confident when I deliver OHI to my patients, because we learn a lot about it in lectures and stuff.
Yeah.
But this is such a beautifully concise way of me revising.
Until I started researching this, I wasn't even confident in going over that thoroughly.
Yeah.
And then once I started researching it and I read the documents inside out, that's when I actually felt much more confident in delivering and understanding how we can move forward.
Yeah, Shivam, it's been amazing talking to you and finding out more about this exciting app, My Dental Care, that you've made. It's incredibly inspirational to see people like yourself, proactive, but so humble. You've achieved some amazing things, and I wish you all the best with My Dental Care.
First of all, it's amazing being back at Barts, but it's actually more amazing seeing students like you who do all this and make change the DenSoc environment and what you guys been up to here. Like, it's actually really inspirational seeing young students like yourself, and you have your own blog.
Yeah, no, thank you. But today's not about me; it's all about you. Shivam, no, seriously, thank you so much, and I wish you all the best. Come back and visit us frequently and often. We'd love to see you back. You're always welcome. Part of the Barts in London family now. It's cheesy, but it's true.
I love Barts. I've had such a great time here, anyways.
Yeah. Cheers.
And I miss all the staff, and I loved seeing all the faces when I came back. So it was amazing. I've had such a good week.
Brilliant. I wish you all the best with your new job in Milton Keynes. Sounds like an incredible associate's position for you to be taking on. And I'm excited to see how useful and helpful My Dental Care will be for our students on clinics, and of course ultimately for the patients.
I guess we'll see.
Cheers, Shivam.
Thanks for having me.
Thanks, no worries. Always.
I made My Dental Care for you and your patients, so it's available now on Play Store and the App Store, so please download it, and I hope it helps.